You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have Arizona's go-to implant dentist, Dr. Logan Cornwell. Dr. Cornwell, welcome to the program.
Thanks, Randy. It's great to be here.
Now, I have a lot of questions, so before I get to those, for people that don't know your practice, like who's the typical dental implant patient you see?
Well, Randy, I have two typical dental implant patients that I see in my office. One is the patient that comes in, they have really bad teeth, really bad bleeding gums when they brush their teeth. Maybe they do or don't floss, and if they do, it bleeds a lot.
Okay.
They have real bad breath, and maybe they even have teeth that are mobile. They're moving a lot.
Okay.
When they bite down, their teeth are moving around, and it's time to just get rid of those, diseased and decaying teeth and get us some, healthy gums again. And these people, they don't know what all their options are. They're worried that they're going to end up in a denture and not be able to eat the food that they want to eat, be able to chew like they used to.
Okay.
And they just don't know what their options are. And so they come to see me because I can give them teeth in a day. I can give them new teeth supported by dental implants.
Okay.
And change their life.
Now, is this true? We talked on the phone. Sounds like an exaggeration, probably to most people and me.
Okay.
That literally on the day of the procedure, that you could safely remove the teeth if it's been determined that you can't save them. Okay. Clean up the gums, put implants in, and put teeth on top of them that day.
That is 100%
That don't come in and out.
That don't
These
come
new
in and
teeth.
out.
Okay.
Yeah, 100%
Is that
true.
rare? Or
It's not rare. This is something that I do sometimes twice a day in my office.
Okay, good for you. Now I interrupted you. So what's the second group of patients you get?
The second group of patients that I get are kind of the hardest people to get in my office because they don't have teeth anymore. They have dentures, and they just don't want to go to the dentist anymore. And they've been told by a lot of other dentists or other people maybe that they're not a candidate for dental implants, and they are stuck with this denture that they can't chew very well with anymore and for the rest of their lives. Those patients come in, and 9 out of 10 times I can get them dental implants and get them new teeth on those implants that are fixed in their mouth that don't come in and out. And it changes their lives.
You don't like dentures?
I don't like dentures. My patients don't like the dentures. Man, they can't chew. They don't smile the way they used to, when they had teeth before. Patients hate them.
I know a couple of denture wearers. They never complain. Are you saying that there's no such thing as like a person that's happy with their dentures?
Well, they don't tell you that they're unhappy with their dentures. They tell me. They
because I'm not a dentist. Okay, good point.
You're not a dentist. You're not the person they come complaining to, right? They come complaining to me, Doc, I can't eat my food. I can't eat corn on the cob. I can't eat apples. I can't take a bite into an apple, let alone chew the darn thing. So, no, they're not happy.
In Arizona, are there a lot of, we think of Arizona as a very healthy place. Are there a lot of people headed to dentures or currently wearing an upper lower denture?
Oh, yeah.
What are some numbers?
Walking on the street, 1 out of 9 people that you see has a denture, whether it be a partial denture,
Wow.
full denture, upper and lower dentures. There are 1 out of 9 people on the street. We have 30 million people in the country that are missing more than, I believe it's 9 teeth in their mouth.
Wow.
So,
I Googled it. It said like 20 plus million people have an upper lower denture.
yeah.
So in Arizona, it's fair to say within an hour of your practice, 50,000 people that are missing.
More.
Really?
Yeah, you could fill up the stadium where the Cardinals play football with people who are missing a bunch of teeth in their mouth.
Then why aren't they doing this? Why aren't they getting a brand new set of teeth supported by implants? What's your take?
I think that there's a lot of factors to answer that question. I think, one, people are afraid of the dentist. They don't love going to the dentist, right? I have a friend that he wakes up every morning and he looks himself in the mirror, and this is a joke he tells his patients, because patients always come in and say, oh, I hate going to the dentist. And so he says, every time I wake up and I look in the mirror, I'm a little bit afraid of myself because it's just like, oh my gosh, I can understand what they're dealing with. And so honestly, I think that's one of the big reasons why.
Fear.
Yeah, people are afraid. People are afraid that it's going to hurt. People are afraid that it's not going to look nice, or that they're going to spend a lot of money and not have much to show for it. You know, everybody knows that the dentist is expensive, and the truth is that, you know, and they think that they can't afford it. That's one of the biggest things, right? And the truth is that there are many options when you come to my office to help get you to be able to afford.
I mean, look, Medicare,
dental
Medicaid,
implants.
insurance doesn't really cover this at all.
No.
But you say people are financing this.
That's right.
I mean, you have to have okay credit, but they're financing it.
They are. Yeah, 80% of the people across the country are financing this type of treatment. It's a good chunk of money, you know, to just shell out right away. But the difference in these patients' lives is remarkable. It's astounding what they can do.
At the top of the show, we said no more dentures. Do you think that's the future of dentistry? Like dentures as we know them today won't exist?
I think we're doing that now.
Okay.
I don't think it's 20 to 50 years in the future. I think we're at that precipice where we're changing from denture wearers to full sets of fixed teeth that don't come out of patients' mouths.
Okay.
They're able to get a new smile, and they're able to go back and chew the foods that they love.
What do they like more, the way it looks or what they could eat with their new teeth?
You know, I think that depends on the patient, but the biggest thing that I see is the way that it looks for the patient. Their whole personality changes.
Okay.
You know, you take somebody that has broken down teeth and you give them a beautiful smile, they're not the same person that they were before. That person is out the window, and they've turned into a completely new person with self-esteem.